Hello everyone, my name is Courtney Cook. I'm a licensed certified genetic counselor and I'm the founder of Cook Genetics Assessment and Testing, which is located in Effingham, Illinois. Welcome back to our video series. Our goal of these videos is to really talk to people about why they might consider having a genetic counseling appointment and possibly genetic testing. We focus primarily on hereditary cancer predispositions. So right now we're focusing these videos on different types of cancers. You might see a bit of overlap in our videos where we talk about similar cancers in more than one video, but we try to have a common cancer that we're talking about and make each video specific. So our previous videos we've talked about breast cancer in our first one, then we talked about ovarian cancer, then we talked uterine cancer and colon cancer. Now we're going to talk about pancreatic cancer. So this video is going to focus on individuals who have a personal history of pancreatic cancer or a family history of pancreatic cancer, and whether or not you should consider doing genetic testing or genetic counseling based on what we see in your family. So at the end of this video, we'll talk about how you get a hold of us, our contact information, but we'll just start at the top with our pancreatic cancer criteria. So for the most part, pancreatic cancer is pretty straightforward. Pancreatic cancer is quite rare. It only occurs in about 1% of individuals. And we know that pancreatic cancer is a pretty deadly cancer. A lot of these cancers are diagnosed at stage 3 or stage 4 because they're really hard to detect. So our criteria for people needing genetic counseling and genetic testing is if you have been diagnosed with a pancreatic cancer yourself, we've got a home run. We recommend that you have genetic counseling and genetic testing. So it doesn't matter how old you are, it does not matter if there have ever been any other cancers in your family. Everyone with a personal history of a pancreatic cancer, we recommend that they have genetic counseling and genetic testing. So going off of that, if you have a first-degree relative who has had pancreatic cancer or a second-degree relative who has had pancreatic cancer, then maybe you should get genetic testing yourself. So we'll remind you what first-degree relatives are. So first-degree relatives are your parents and your siblings and your children. Your second-degree relatives are the next step out. So that would be like your grandparents, your aunts and uncles, your grandchildren, your nieces and nephews, things like that. So if you have not had a pancreatic cancer yourself, but you have a family history of any of those people I just mentioned have had pancreatic cancer, we recommend that you have genetic counseling and genetic testing, especially if that person has already passed away. So that's pretty straightforward for pancreatic cancer. I do want to mention that there are some different types of pancreatic cancer. So typically whenever you hear someone say pancreatic cancer, we are thinking about the pancreatic cancers that are in the exocrine cells of the pancreas. So that's whenever you typically hear pancreatic cancer, that's the type of pancreatic cancer that most people think of. There are other pancreatic tumors that we call pancreatic neuroendocrine tumors. So these form in like the islet cells of the pancreas. So a pancreatic neuroendocrine tumor might secrete hormones. It might cause somebody to have some other symptoms like heartbeat that's racing for no reason, or lots of flushing, or it might cause their blood pressure to be really, really high and out of control, and it's because that tumor in the pancreas is secreting a lot of hormones into their system. So neuroendocrine tumors of the pancreas are super rare, even more rare than our regular pancreatic cancer. So if anybody has been diagnosed with a pancreatic neuroendocrine tumor, or you've had a close relative diagnosed with a pancreatic neuroendocrine tumor, absolutely that is something that you should consider genetic counseling and genetic testing for. It would just be different genes that we would test you for, but still a very good reason to have a genetic counseling appointment. Now, the last thing that we always talk about Nowadays, if somebody has been diagnosed with cancer, they've typically had what we call some tumor genomic testing. So this is whenever the doctor might do a specific test on your tumor itself to see if there are any changes in the tumor, and they might be trying to find some targeted chemotherapy treatments based on what the tumor looks like. So if you've had any sort of tumor genomic testing, then talk to your doctor, see if there were any results on there that your doctor's concerned about, that they might think, oh, maybe we should do some genetic testing just based on what our tumor looks like. So that gets more complicated. We really want to make sure that we get your doctor involved in that. Or if you've had tumor testing and you're not sure, you can feel free to reach out to us and ask us based on what your results are. And otherwise, talk to your doctor about that, and they might recommend whether you need genetic testing or not based on that tumor result. So pancreatic cancer, pretty straightforward here. If you've ever been diagnosed with a pancreatic cancer, or if you have a first-degree relative or a second-degree relative diagnosed with a pancreatic cancer, that includes the neuroendocrine tumor type, then genetic counseling and genetic testing is for you. So, how to find us? You can absolutely visit our website to book an appointment or to find frequently asked questions, more information about genetic counseling and genetic testing. So go visit our website. It's www.cookgenetics.com. And then you can also reach out to us on Facebook, Instagram, Twitter, or email. My email address is courtneycook@cookgenetics.com. And you're more than welcome to reach out with any questions that you have. So let us know if you need anything as far as personal or family history of pancreatic cancer. Otherwise, we look forward to seeing you soon.